Hi everyone, I'm Dr. Tirta Wijaya. On this channel, we will discuss various health topics and today we will talk about tattoos. I brought this topic up because one of our healthy buddies asked me why doctors are not allowed to have tattoos. Our healthy buddy wants to be a medical doctor, but he has tattoos. I replied him right away that as far as I know, there is no prohibition on doctors to have tattoos. So I encouraged him to apply to medical school to pursue his interest to be a medical doctor. But then he asked me again.
If doctors are allowed to have tattoos, why don't they have tattoos?
I wondered why he responded that way. But I decided to discuss it in a video because this is an interesting topic to share with all of you. I will talk about it in general first, then move on to the medical explanation. If you are not interested in the general explanation, you can skip the next part and go straight to the medical explanation. I will add a timestamp here in the final edit. As I said earlier, there is no rule, regulation, or law disallowing doctors to have tattoos, at least in Indonesia, where I studied medicine and served. I believe it is the same in other countries too. When I applied to medical school, we were required to pass a battery of medical examinations. This included general health checkup, color blindness, and a urine test to screen out drug abuse. However, the doctor who examined me didn't check for tattoos at all. After graduating as a medical doctor, when I applied for a job, tattoos were not even mentioned, nor was I checked for tattoos. When I became a hospital director, we happened to have a vacancy for doctors. Even then, we didn't require doctors to be tattoo-free. For doctors practicing independently, they can set their own rules. Maybe there are certain hospitals or clinics that don't allow their employees to have tattoos, but this is company policy, not a prohibition related to the medical profession. As for the second question, the explanation is more interesting. As far as I can remember, none of my school friends or colleagues have tattoos. This includes my fellow students in the Faculty of Economics and my colleagues from before I studied medicine. There was no prohibition on tattoos, but none of us have. Of course, I can't answer on behalf of all my friends in the Faculty of Economics or medical school, as well as my colleagues, both are medical or non-medical. Everyone has their own reasons. So, here is my explanation as a doctor why I don't have tattoos, even though there is nothing prohibiting me from getting tattoos. First, tattoos has no benefit for me. Having tattoos on my body doesn't make my life easier, more enjoyable, or anything like that. On the contrary, they could potentially cause problems for me. If I had gotten tattoos as a teenager, my parents would have been furious because I was wasting money and time on something deemed useless by them.
But they are useful tattoos, like eyebrow or lip tattoos. They save time, eliminating the hassle of drawing eyebrows or applying lipstick.
Even if tattoos do have benefits, their harms far outweigh those benefits. I will explain these harms in more detail from a health perspective later. Personally, I think eyebrow or lip tattoos are indistinguishable from regular makeup, so no one would likely object to them as long as they look like natural lips or eyebrow. But for the sake of this discussion, I consider them the same. Since I don't really like to put on makeup, the benefits of such tattoos are minimal. Even if I do need to wear makeup, drawing eyebrows and applying lipstick can be done in less than 5 minutes. The time I save by getting a tattoo is not worth the risk. The second reason, tattoos are permanent, while my needs or tastes can change. For example, lip tattoo color is permanent, while lipstick colors can be changed to suit the mood, event, outfits, and so on. If you get a lip tattoo and then want a different color, you will still need to use the lipstick, right? So, yeah, it's quite useless. The same goes for eyebrow tattoos. They are permanent, while eyebrow trends can change over time. If you have thin eyebrows, then the trend becomes thicker. You can still use makeup as usual, which would make the tattoo useless. But what if you have thick eyebrow tattoos. Then the trend changes to the thinner eyebrows. The third reason, I've never found a tattoo artist who made me want to have their work being displayed on my body for the rest of my life. Because tattoos are permanent, I am much more selective than choosing, say, a hairstylist, couturier, or makeup artist. If my hairstylist isn't skilled enough or I don't like the results, I just wait for my hair to grow back, but not with tattoos. There are procedures for tattoo removal, but these are expensive, often more expensive than the tattoo itself, and also carry their own risks, which I will explain later. The fourth reason, I believe that the body God created is good and deserves to be cared for as well as possible. We are created in the image of God, and God saw everything that He had made, and behold, it was very good. Our body is good by God's standard. No matter how beautiful the work of the most skilled tattoo artist in the world, I still find it inferior to God's work. So I choose to care for the body God has given me. If it is damaged, I will do my best to fix it. But if it is in its original condition, it is good. It doesn't need further modifications. Since this is a health channel, next I will talk about the health risk of tattoo. But first, let me explain the basic concepts related to tattoos so you can understand what I'm talking about. This is a cross-section of the skin, which consists of three main parts. This is the dermis and the epidermis. The word derm comes from the Latin term meaning skin, just as dermatology means the study of the skin, while epi is a prefix meaning above, just as epitaph means above a tombstone. So epidermis means the layer above the skin. The yellow thingy is the subcutaneous adipose tissue. The word adipose comes from the Latin term meaning fat. Sub is a prefix meaning under, as in the word submissive, meaning to position oneself under someone else. Cutaneous comes from the Latin term meaning skin. So subcutaneous adipose tissue means fat under the skin. The part of the epidermis adjacent to the dermis is the stratum basilis, the base layer, which continuously produces new skin cells. These newly produced cells push the older ones upward, further away from the dermis, eventually reaching the top layer and shredding. Normally, skin cells last for 28 days from the time they are first produced until they are set. So, tattoos made in this epidermis are not permanent because they will set along with the dead skin cells in less than 4 weeks. To make permanent tattoos, the tattoo ink must be deposited in the dermis, which is rich in collagen and contains many other skin structures such as hair follicles, sweat glands, blood vessels, nerves, and so on. This is important information for a more detailed discussion of the medical risks of tattoos later in this video. In the dermis, tattoo ink remains relatively stable at the injection site because collagen is a dense structure. This is like being in a super crowded place where it is very difficult to move around. When a tattoo needle penetrates and damages the skin, an inflammatory reaction occurs as the immune system attempts to repair the damage and prevent infection. Various types of immune cells flock to the tattoo needle puncture site. Macrophages play a crucial role in tattooing. Macro means large and phages means devour. These are type of immune cells that works by devouring, chewing, and destroying foreign substances perceived as threatening to the body. Macrophages will engulf the tattoo ink pigments in an attempt to destroy them. Some pigments can be destroyed quickly, while others take longer time, depending on the ink and the strength of the tattoo individual's immune system. Permanent tattoo inks are generally made from materials that cannot be easily broken down by macrophages. Therefore, in an effort to protect the body from foreign objects, macrophages will keep the ink pigment in them throughout their lifetime. Lasers can also break down tattoo ink particles into smaller pieces, making them more easily to be transported by the immune system. The laser beam destroys not only the tattoo ink particles, but also the macrophages that engulf that ink particle, making the process much faster and effective for tattoo removal. because they don't have to wait until the macrophages die. However, this depends on the type and the size of the tattoo ink particles used. Some can be removed with only small residue, while others can remain visible even after repeated laser treatments. The pulverized tattoo ink particles are then transported by immune cells to the lymph nodes or other body tissues. Some are excreted in the stool through the liver, but most ink pigment never really leave the body. This, of course, varies depending on the pigment being used in the tattoo ink. Skin thickness can vary from one person to another, and even on the same person, it can vary from one body part to another. It is possible for a tattoo needle to penetrate the subcutaneous tissue, especially if it is done by an unskilled tattoo artist. What happens if the tattoo is too deep and penetrates the subcutaneous tissue? Because fatty tissue isn't as dense as collagen, subcutaneous tattoos will appear blurry. There are also health risks associated with this. Now that we know the basics, before we delve into the medical risks of tattooing, I'd like to state a disclaimer. In my opinion, tattooing is an invasive procedure that carries risks to the individual's own health. This is similar to dermal rolling at a hotel, female circumcision, or having marbles inserted into the penis, dental procedures like scaling or braces not performed by a dentist, and so on. These health risks don't directly impact others. While I personally dislike tattoos and forbid my children from getting them, I'm not explicitly stating that tattoos are bad. My explanation in this video is medically based, intended for educational purposes, so you will understand the health risks of tattoo and can make informed decisions. In addition to the risk, I will also share what can be done to reduce the risks. The first risk of tattoos is skin infection. One of the skin's primary functions is to protect the body from various bacteria, viruses, and other external agents, preventing them from entering and causing problems in our bodies. When making tattoos, the skin is intentionally punctured, injured, damaged, compromising its integrity, allowing germs and dirt on the skin surface, which should not be able to enter, to gain access. This occurs when tattoos are performed by tattoo artists who lack of hygiene and proper disinfection practices before creating the tattoos. Not only open the door for the germs and dirt to enter, the tattooing process also delivers the germ and dirt into the exposed dermis. Infection can also occur if the tattooed person fails to maintain proper wound hygiene. This skin infection appears red, swollen, itchy, painful, and can even develop pus. After healing, the infection can leave a permanent scar on the skin. This risk can be reduced by taking care of the tattoo wound properly and by choosing a tattoo artist who understands hygiene and performs proper disinfection. Unfortunately, this profession lacks standardization and certification, so we cannot be certain whether a tattoo artist has sufficient knowledge of hygiene. Oftentimes, people choose their tattoo artist based on the artistic value of the tattoo. The portfolio displays various beautiful tattoos the artist has done in the past without any information about their hygiene practices nor sanitization. Some countries are starting to monitor tattoo parlors just as they are monitoring clinics, but in many countries, tattooing is still unregulated. The second risk is the transmission of various blood-borne diseases. Many diseases can be transmitted to blood, such as hepatitis B virus, which can lead to liver cancer, and HIV, or human immunodeficiency virus, which can cause AIDS, acquired immunodeficiency syndrome, for which there is currently no known prevention or cure. This transmission occurs when tattoo needles, tattoo inks, or various equipment used in tattooing process are contaminated with blood containing the germs, the virus, the bacteria. To prevent this, in addition to implementing hygiene standards and proper disinfection, all equipment, supplies, and tattoo ink that come into contact with blood should be kept sterile before use and should only be used once and then discarded or disposable. This is certainly more expensive than using reusable tools and equipment and economical ink packaging. The third is allergy to tattoo ink pigments. Allergic reactions manifested as rashes or itching in the tattoo area can occur at any time, even years after the tattoo is applied. According to various case reports, the tattoo inks that most often trigger allergic reactions are red ink, green ink containing chromium, yellow ink containing cadmium, and blue ink containing cobalt. Allergies can occur in people with no prior history of allergies and can also be triggered by tattoo ink claimed to be made from natural ingredients. Just as some people suddenly develop allergies to poison ivies, eggs, nuts, nettles, shrimps, and other natural substances, natural ingredients in tattoos can also trigger allergies in some people too. Please excuse me for a little intermezzo here. The term natural, organic, and similar terms don't always mean safe. Many natural organic substances in nature are harmful to health. For example, scorpion venom, snake venom, and botulinum toxin, all of which are naturally found in nature, but they can kill. Using the term natural to give the impression that a product is safe is a misleading and potentially dangerous marketing ploy. To reduce the risk of tattoo ink allergies, you can try avoiding red, green, yellow, and blue tattoo inks. Ink allergy testing can be done as well, but please keep in mind that some allergic reactions may not develop until years later. People at risk of life-threatening anaphylaxis should always have an unexpired EpiPen on hand in case their allergy is triggered by tattoo ink or other substances. Number 4 is the risk of other skin problems, such as granulomas or keloids, triggered by the tattoo pigments or the tattooing process. If this happens, instead of enhancing the beauty, the tattoo area will appear unhealthy. Fifth is the risk of dangers from tattoo ink ingredients, which can be toxic or carcinogenic. Carcinogenic means causing cancer. Tattoo ink production is not strictly regulated by any specific agency, unlike drug production. Even though tattoo ink is invasively injected into the body and remain in the body for decades. Some tattoo artists, especially traditional ones, even produce their own tattoo ink, making it more difficult to monitor the safety of its ingredients. Another intermezzo. Just like the term natural, traditional doesn't always mean healthy, safe, or good. There are traditional practices that are unhealthy, unsafe, such as child marriages, teenage childbirth, and having too many children. Those are traditional practices. The dangers posed by certain ingredients in tattoo ink may take years, even decades, to develop. Most of them are not immediately apparent, so many people are often unaware of them. This is similar to smoking-related cancer, which generally only appears after decades of exposure to cigarette smoke. Therefore, the main way to reduce this risk is to monitor tattoo ink production for user safety, while users should be careful when choosing the ink they inject into their bodies. 6. Tattoo can sometimes interfere with MRI scans, resulting in less than optimal image quality. Sometimes, during an MRI scan, the tattooed area can feel hot and burning. While not everyone needs an MRI, and not everyone with tattoos experience this during an MRI, this risk exists. 7. Tattoos made it difficult to detect skin diseases early, especially skin cancers. Finally, sometimes people regret their tattoos and decided to remove them. For example, after a bad breakup or divorce, or because they have difficulties to find a job, and so on. A common method to erase a tattoo is to destroy the tattoo pigment using a laser. About 60 to 90% of the tattoo pigment is then transported to the lymph nodes and other organs such as the liver, spleen, and lungs through the bloodstream. And we can say that the ink pigments, most of them, remain in the human body for life. To date, there have been no large-scale studies on the effect of tattoo inks pigments in humans, as conducting such research is ethically difficult. However, several case reports suggest a link between the occurrence of lymphoma and tattoo ink. Research in mouse macrophage cell cultures has shown that cobalt pigment, which commonly found in the blue tattoo ink and its derivative colors such as green and purple, and zinc, which found in white tattoo ink, cause a chronic inflammatory reaction that permanently weakens the immune system due to the increased nitric oxide and decreased tumor necrosis factor, which in turn cause reduced immune system's phagocytosis ability, making the body more susceptible to bacterial infection. Then slower skin healing process due to reduced macrophages migration. Then impaired ability to recognize cancer cells. If you are looking for more detailed information, here is an article about short-term and long-term reactions and complications of tattoos in a journal on hygiene and toxicology. The journal is free to access. I will provide the link in the description below. That is my sharing today in answer to question why doctors are not allowed to have tattoos. I hope the information I've shared is useful and can be a blessing. If you enjoy this kind of health information, please like this video, subscribe to my channel, and activate notifications by pressing the bell button. If your family or friends need this information, please feel free to share it so it can be a blessing to more people. If you have any health-related topic you'd like me to cover in the next video, whether related to tattoos or other topics, you can leave them in the comments. But a gentle reminder, I cannot do consultation here. This is my disclaimer. See you in the next video. Stay healthy and happy.